minimize the impact. That's the goal, regardless of the situation. But your team will ground you into the foundations of what you know. And you hear Mike and I talk, and the DG talk a lot about the public health fundamentals. We are grounded in the fundamentals of what we know works, and that's why we repeat that a lot. But a lot of the times when any situation is overwhelmed, even in our own personal lives, it's just, what is the issue? What do we know about it? What can we do next? And then after we do that, what do we do next? Many people right now are in situations, I have friends, close friends, who have just been infected. What do I do? How do I handle this? How do I take care of my kids? My immediate family is not around. I'm thinking about this with my own family. If I were to get infected, if my husband were to get infected, we have 2 children, what is the plan? How do we think through these different things? And I'm sure everyone across the world is thinking about this right now. Or I have been infected. I've made it through. My loved one hasn't. All of these things we have to kind of think through. But it is a step-by-step approach. And when everything feels overwhelming, what is the next step? What is the next step that you can do?
Thank you very much. And
people recover, but it does have an impact on a lot of aspects of our lives. And so when there are plans that are in place, and if you look at pandemic preparedness plans, which were focused on flu before, a lot of that also discusses businesses and what to do there. In this type of situation, we've also had to think about businesses and how to keep businesses operating while a pandemic unfolds. And in many parts of the world and in many jobs, many people can work from home, but that's not true for all jobs. So there are many people who fill grocery stores. There are farmers. There are people who sell food, people who sell food for restaurants and hotels, and there's businesses that have to keep open. So it's finding that balance. But we need to, governments and people need to be able to support those businesses as well. But there's ways that we can help too. You could buy local, for example. There are many people who, if you can buy from a local shop that is open safely, wearing your mask and keeping your physical distance and using your hand hygiene, but buy local, that will help local businesses. In many parts of the world, restaurants are closed, but they can do takeout. You can buy that takeout. We've seen in a number of countries, restaurants that haven't been able to sell food, they've donated or sold food to medical facilities. There's lots of different creative ways that I think we can try to keep businesses going. And we're being inspired by all of the different ways people have found. But there does need to be support given to businesses that have been asked to close, for example, because we do recognize that people's livelihoods are really at stake as well.
Stress, internal displacement, migration, they all existed before COVID. COVID didn't invent these things. What COVID has done is really amplified and revealed and unveiled some of these deep-seated inequities in our society. The way we treat older people, the way we treat marginalised people, how insecure work is now, and people having to not be able to get a fair losing the job, not because of the wages, but maybe because of the health insurance or something that goes with that job. So how indentured and how dependent people have become, and how most households now need 2 full incomes just to survive if you have kids. So you can't afford to lose anything. There's no safety valve, there's no safety net. The lack of safety nets in countries, the lack of social systems that support people who are in trouble, all of that is being revealed and amplified by this. But they've kept things under control. We have to learn these lessons. We simply have to learn these lessons. One of the biggest reasons why this disease is continuing to spread is because contacts are not being identified or self-identifying and not staying at home for 14 days in quarantine. And that's exactly what drove the epidemic in other places. So I hate to bring it back to the science, because I might feel desperately sorry for everyone who's affected. We are all affected by this, and especially those who risk losing their businesses or their jobs. Everybody is suffering. But I'm sorry to speak a hard truth. There is no way out of this right now, except letting this thing run wild and our hospitals become overwhelmed. We have the hope of a vaccine, but that is not a guarantee. So our best shot at this is to do better at trying to control this disease and ensure too that we keep our health systems up and running and protect our most vulnerable citizens. And That's the best way to protect the economy. That's the best way to get back to normal. And that means everybody, all of us, every single person, me included, we all have to look at our risk. We were here last week talking about our own building, and we were looking at the numbers going up in Switzerland. We were saying, okay, we have the number of people in this building this week. We should be increasing the number of people in this building, but we sent more people home because we wanted to reduce the risk. And we're modulating our behaviour here according to that risk. And we may reduce it again next week, and then we'll bring people back again in 3 or 4 weeks' time. We're trying to manage our risk as individuals. We're having to do that too. We're not just having to lecture to the world about this. We're living this with you all in terms of our families, in terms of our workplace, our environment, and it isn't easy. So I think we have to do the two things. One is support people better, and governments need to do that. But at the same time, we all have the answer to this